So moved. Go ahead. Ladies first.
The motion's been made. All in favor say aye. Aye. Opposed? The motion carries. Everyone's seen the minutes for our February meeting. I'll entertain a motion to approve those minutes.
So moved.
The motion's been made. All in favor say aye.
Aye.
Opposed? And the motion carries. At this time, we're going to give out some resolutions honoring some people. And I'm going to come forward with the first one. You'll bring this right up here, Ed. Let me check here. Ms. Crowder, it's an honor to have you here tonight.
Well, thank you.
I'm going to read this resolution from us, from the Board of Supervisors. Whereas the Mecklenburg County Board of Supervisors proudly recognizes Ruth Allen Crowder, born January the 15th, 1926 in Boynton, Virginia, daughter of Anna Oslin Allen and Hannah Nathaniel Allen, and a lifelong devoted resident of Mecklenburg County and the town of Boynton, as she celebrates her 100th birthday. Whereas she married her high school sweetheart, Edwin Alexander Crowder, and together they built a loving family, raising one son and enjoying the blessings of 3 grandchildren and 5 great-grandchildren. Whereas Ms. Crowder has demonstrated a deep and lasting commitment to her community through service on zoning commissions, participation in church and historical organizations, and through her artistic works depicting local buildings, including the courthouse, churches, and town and county seals, reflecting her appreciation for the heritage and architect of Mecklenburg County. And whereas a longtime resident, she has shared memories and knowledge of the community's past, often called upon to recall times before others can remember, and has long been known as a welcoming neighbor who formed lasting friendships and warmly greeted newcomers. Now, therefore, be it resolved that the Mecklenburg County Board of Supervisors hereby congratulates Ruth Allen Crowder on the celebration of her 100th birthday and expresses sincere appreciation for her lifetime of community pride, service, dedication, and be it further resolved that a copy of this resolution be spread upon the minutes of the board and presented to Ms. Crowder as a token of the county's gratitude and best wishes for continued health and happiness. Congratulations, Ms. Crowder.
I know you're a favorite child, right?
All right, very good. Ed.
Thank you very much.
You. All right, Mr. Brinkley, I believe you're up next.
Both family come forward. Yeah, you have to. Oh, my. Got to. You got to. This resolution honoring the life of Samuel Bugg. Whereas the Mecklenburg County Board of Supervisors joins the citizens of Mecklenburg County in mourning the passing of Samuel Bugg, age 100, of Boston, Virginia, who departed his life on January 16, 2026. Whereas Mr. Bugg was born September the 3rd, 1925 in Chase City, Virginia, the son of the late Richard Bug and Corey Ware Bug, and lived a long life defined by service, faith, hard work, and devotion to family and community. Whereas his honorable service served his country as a member of the United States Navy during World War II. Whereas he was a longtime member of Centenary United Baptist Church, a 60-year member of the Chase City Lions Club, and a member of the VFW Post 8228 and American Legion Post 43, demonstrated his lifelong commitment to civic and veteran service. Whereas Mr. Bug was a respected entrepreneur and jack of all trades, operated an independent grocery store in Chase City for many years, and later owned Bug's Campground and Closet, contributed to the local economy and community life. And whereas he was the devoted husband, father, grandfather, great-grandfather, and friends whose legacy lived as through his children, grandchildren, great-grandchildren, extended family, and caregivers. Now, therefore, being resolved that the Mecklenburg County Board of Supervisors hereby expresses deepest sympathy to the family of Samuel Bug, honor his century of life and service, and recognize his lasting contribution to the citizens of the community of Mecklenburg County. Thank you all.
Might be some big words in there.
Just pass them on down. Thank you. Okay, we got one more resolution honoring somebody, and Judy Sheffield will read that one. We need to, didn't you say we need a motion to, let's adopt that resolution? Ms. Brankley, you want to make that motion?
Yes, I'd like to make a motion we adopt that resolution, sir.
All in favor of the motion, say aye.
Aye.
Opposed? The motion carries. Thank you.
It's an honor that the board asked me to read this to Kyle. Kyle is a very, very good friend to me and my family. I love his family, and it's just an honor. So, this is a resolution honoring Kyle Crump for his service to Mecklenburg County. Whereas Mr. Kyle Crump joined the Mecklenburg County Planning Commission in July of 2000 and faithfully served the citizens of Mecklenburg County for 25 years before retiring from the commission on August of 2025. Whereas during his tenure on the Planning Commission, Mr. Crump served 19 years as chairman, providing steady leadership, guidance, and dedication while helping to shape policies and decisions that supported reasonable growth and thoughtful development throughout the Mecklenburg County. Whereas Mr. Crump is widely respected throughout the community as a hard-working farmer and as a longtime employee of the Virginia Department of Transportation, where he contributed to the infrastructure and transportation systems that serve the residents of the Commonwealth of Virginia. Whereas Mr. Crump has also been a faithful servant in his church and community, serving as a deacon and a longtime member of New Hope Baptist Church in Skippack, Virginia, where he has exemplified leadership, integrity, and a deep commitment to his faith and fellow community members. Whereas Mr. Crump is a devoted husband to his wife, Patricia, a proud father to Anna and Wesley, and a loving grandfather to Silas, and his dedication to family, community, and public service has made a lasting impact on those around him. And whereas the Mecklenburg County Board of Supervisors wishes to recognize and express its sincere appreciation for Mr. Crump's many years of dedicated service, leadership, and contributions to Mecklenburg County and its citizens. Now therefore be it resolved that the Mecklenburg County Board of Supervisors hereby commends and honors Mr. Kyle Crump for his 25 years of service on the Mecklenburg County Planning Commission, including 19 years as chairman, and extends its gratitude for his commitment to public service and the lasting contributions he has made to Mecklenburg County. Be it further resolved that the Mecklenburg County Board of Supervisors extends its best wishes to Mr. Crump and his family for continued health, happiness, and success in the years to come.
That's one we did.
You stay with me. I don't know.
You want everybody?
Yeah. Yeah. Come on.
Yeah, you did the right thing. Get Jenny to do that. Yeah.
Did really good. I was expecting
You expect me to
Yeah,
cry?
I did.
About 10 minutes ago, they wanted me to do that.
They keep coming up and we're gonna have to remodel the place.
Alex said, "Oh, they'll be constructed it tomorrow." Thanks, Kyle.
Absolutely.
Thank you.
Thank you. Appreciate it.
Thank you, Kyle.
We're gonna give everybody a couple of minutes to,
Say the room be empty now.
that needs to leave to go ahead and leave before we start with our zoning applications.
Which one? Sorry. Okay. The chapter 34. Chapter 34.
All right, we'll start with zoning now. Lucky, you want to
Almost dead, dead and burning.
present the first application?
No, it's fine. Good evening. So the first application is from Celco Partnership, Verizon Wireless. It's for a special exception permit for a proposed 199-foot monopole communications tower. It is located at tax parcel number 38231. It's located on the west side of Route 655 Skyline Road. It's in Election District 6. The Planning Commission recommended approval of this application.
Okay. Anyone wishing to speak on behalf of the application, please come forward.
Sorry about that. There we go.
Limited communications. Push the cord back.
I think that'll do it. Oh, it's the, yep, you're right. You're absolutely right.
It's all good.
Don't move. We need some of that wireless service in here.
Yeah. It's all good. There it is. Leave it alone. It's working quick. Talk fast.
I think we're in business. Good evening, supervisors, staff. Hope your week is off to a great start. I've been in front of this board before. This application is similar to the one we heard last time. My name is Anthony Bologna. I'm with the law firm of Williams Mullen, and this is the Whittles Mill Tower at 3918 Skyline Road. So here's a short recitation of the history and the facts of the site. The address, again, is on Skyline Road. The property is zoned AG. The
The tower height is 195 feet with a 4-foot lightning rod, bringing it to 199 feet total. It's a monopole tower. The anchor tenant will be Verizon Wireless, but there will be space for 3 additional carriers. The site is located in the northern portion of Mecklenburg County. So in Mecklenburg County, there's a 3-step process. We've got a 2232, which was unanimously approved on January 15th of this year. And then the Planning Commission voted unanimously to approve the SUP last month on February 19th. Here's our parcel plan, which is effectively the site plan. This is a really big parcel. It's about 125 acres. Here's a site plan showing the site and our plans in greater detail. Here's an elevation drawing of the tower. It's, again, 199 feet total. There'll be Verizon Wireless will take that top rung where the antennas are shown. But, to the extent that another carrier decides to locate on the tower, T-Mobile, AT&T, or otherwise, there'll be space for that too. This is the visibility map for our photo sims, where we test how visible the tower is from certain vantage points, whether those are public right-of-ways, subdivisions, things like that. Here's photo 1, tower is hardly visible. Photo 2, same thing. Photo 3, 4, a little more visible from here. This is on Highway 47 and Chalk Level Road. Photo 5, photo 6, photo 7. And that's all I've got. I printed out physicals of our zoning drawings for you to see. I live by the saying that depictions are better than descriptions, so if that's helpful, those should be in front of you. But I'm happy to answer any questions. Sean Shai is here as well. Thank you for your time.
Anyone have any questions? Okay. At this time, I'm going to open a public comment. Anyone wishing to speak on behalf of this application, please come forward. Hearing no one, I will close the public hearing. Mr. Wilkerson, I believe it's your district.
Yes, sir. Thank you, Mr. Chairman. I'd like to make a motion to approve this special exception permit with the recommendations of the Planning Commission.
Everyone's heard the motion. All in favor of the motion say aye. Aye. Opposed? And the motion carries. Lucky?
Good evening again. The next application is a request from the Towers LLC for a special exception permit to allow a 199-foot monopole communications tower. It's located at parcel record number 39988. It's located on the west side of Highway 15, and this is in Election District 9. The Planning Commission also recommended approval of this application.
Okay. Anyone wishing to speak on behalf of the application?
Good evening again. Again, Anthony Bologna. This is for the Tunstall Farm Tower, substantially similar to the last tower in height, design. I'll take you through a quick PowerPoint. So again, this is on Highway 15, zoning designation AG, tower height is 195 feet with a 4-foot lightning rod, monopole tower. The anchor tenant will be Verizon Wireless. There's space for 2 additional carriers on this tower, provided that the county will have an opportunity to co-locate on this tower at 100-foot rad center. The subject parcel is in the southern portion of Mecklenburg County and borders closely with the Virginia and North Carolina state line. On this one, the 2232 was approved on December 18th, so at the end of last calendar year, and the Planning Commission voted unanimously to approve the special exception, special use permit on February 19th last month of this year. Here's our overall site plan. Here's an enlarged site plan. Here are the elevation drawings. This shows the anchor tenant at the top, Verizon Wireless, with 2 extra opportunities for co-location, and then the county's potential co-location opportunity at roughly the middle of the tower. Here is our visibility map, again, from where we produced renderings. Photo 1, Photo 2, Photo 3, Photo 4, Photo 5, 6, 7, 8. And that concludes the presentation. I do want to note in Cityscape's report, they recommended clarifying the means of meeting the requirement of Section 1411 for an opaque fence to surround the tower compound. So what we would typically do, this is a chain link fence, and you would install what are called privacy slats. Those are usually like an earth tone color, a green, sometimes a brown. It's not recommended by us here because the site is heavily wooded. There's existing landscaping. The tower's pretty well set back onto the property. I'm not sure that privacy slats would add anything meaningful to the privacy or the visibility of the tower or the ground equipment. So just wanted to bring that to your attention to the extent that that was considered as being a condition to the permit. We'd respectfully ask that requirement be waived. But I'm happy to answer any questions. And again, thank you for your time, commissioners and staff.
Okay. Anyone have any questions? Hearing none, I will open the public hearing. Anyone wishing to speak, please come forward. Hearing no one, I will close the public hearing. Mr. Gravitt, I believe that's your district.
Thank you, Mr. Chairman. I'd like to make a motion to approve based on the Planning Commission recommendation.
Okay, everyone's heard the motion. All in favor say aye. Aye. Opposed? And the motion carries.
Thank you for your time.
Thank you. Thank you, Lucky. Fred, I think you're up next.
Good evening, Mr. Chairman, members of the board. Do y'all want to do the hearing first?
Yeah.
Okay. You want to take the lead on that?
Sure, I'd be happy to. We received a request from Nutrien. They wish to abandon Cougar Drive, which is at the old Parkview Middle School site. This is the road that is on the left-hand side of the school. So if you have 58 here, you have a row of houses, and then you would have Cougar Drive, and then you would have the Parkview Middle School site. The reason this was not turned over earlier is because the residents that back up to Cougar Drive and front 58 all have been using this as their main entry exit point for generations. Nutrien had conversations with those property owners, and they've all agreed on a right of access. And so everybody on that row of houses will still have the ability to traverse through Cougar Drive even after its abandonment. That was pretty much, I would say, the county's position on the matter is as long as the property owners still had the right to entry and exit, as they've always done, then we would be okay with the abandonment. That standard was achieved, and so that is why the abandonment is now in front of you to consider for removing Cougar Drive from the state secondary highway system.
Okay. So we need to open a public hearing on
That
the
is correct.
abandonment of Cougar
Yes.
Drive.
Yes.
All right. We'll now open the public hearing for the abandonment of Cougar Drive. Anyone wishing to speak, please come forward. Hearing no one, I will close the public hearing. The wishes of the board. Mr. Wilkerson.
Mr. Chairman, I'd like to make a motion to approve the abandonment of Cougar Drive from VDOT's secondary road system.
Everyone's heard the motion. All in favor say aye. Aye. Opposed? The motion carries. Brad, your monthly report now.
Yes, sir. I'd like to add a few comments to that since the report has been sent to you all. We received 43 total complaints from the citizens throughout the county, and as of today, we've closed all but 4 of those. Crews are currently patching potholes, and that's an ongoing process throughout the county. Machining unpaved secondary roads and adding rock as needed. Also performing shoulder repairs and ditching operations along with brush cutting and limbing trees. We have no planned closures, and we issued 23 permits for the month. And I briefly spoke last time about the contracts that were awarded. Currently, right now, our surface treatment contract will start at the end of March. That'll be through Whitehurst Paving. Also, Slurry Pavers has been awarded the 26 latex modified schedule. They look to start sometime in the end of the spring. And Adams Construction has been awarded the plant mix contract for Mecklenburg County. They anticipate a May 26 start date. The design build project on I-85 at mile marker 3 southbound, that project is still slated to start sometime this spring or early summer. I'll keep you updated as information comes. And Mr. Hargrove, I do want to report we have not forgot about Ivy Hill. We've just been inundated with the winter weather and now pothole blitz. That's all I had to report, and I'll welcome any comments or questions.
Okay, any questions? Thank you for your report.
Thank you.
We got the public hearing on the revision of the Chapter 34 of the Code Ordinance on Emergency Services. Alex, you gonna do that? Justin, you?
Yeah.
Okay.
Mr. Chair, members of the board, in front of you is a proposed revision to Chapter 34 of our Code of Ordinances. This deals with emergency services and emergency law more generally. The proposed chapter is broken up into 3 different elements. The first item deals with definitions as well as establishment and some other more general procedures. The second article deals with the emergency laws. Our old Chapter 34 was very heavily weighted towards emergency law only. However, it was using the verbiage and the language of what was in the code decades ago. And so we needed to make some updates there, bring the language into 2026. Obviously, a few years ago, there was a very substantive event related to emergency laws that everyone in the world had to deal with. And so there were a number of provisions that stemmed out of the COVID period that now needed to be added to our ordinance as well. We also needed to make some updates to some language in relation to emergency management as opposed to emergency services. The third article had to do with emergency medical services. That was something that we probably ought to have done a few years ago when we onboarded service delivery in the county, but at the time we did not do that. But it is now time to update that, incorporate that. We run the service. We have a coordinated, or want to have a coordinated service here in Mecklenburg County. So it's incumbent on us to put that into place through our ordinances. So that's just, I know that's a very high level summary of this. However, it has been previously reviewed by the Emergency Services Committee. They recommended that this ordinance be adopted by the full board. It has been publicly available for several weeks, both electronically as well as if anybody wanted to obtain a copy, that was made available. The ads have run in the papers, so it's been out there for a little while for people to inspect. But per the Code of Virginia, we do need to have a public hearing on this ordinance and its provisions therein prior to your adoption, if you so choose to go forward with that route.
Okay. Any questions before we open the public hearing? Okay. We will now open the public hearing on the Code of Ordinance related to emergency law and services. Anyone wishing to speak, please come forward. Hearing no one, I will close the public hearing. The wishes of the board.
Mr. Chairman, I would move to adopt the revision of Chapter 34 of the Code of Ordinances related to the emergency law and services tonight, please.
Okay, everyone's heard the motion. All in favor say aye. Aye. Opposed? And the motion carries. Okay, we got the Piedmont Access to Health Services, PAFS presentation.
Thank you for your time tonight. I know we've been here before. I wanted to share some updates with you to the organization, as well as some additional information that I'd like you to consider within the county related to an influx of a specific drug that seems to be causing problems for our citizens. So, in the past, when we have talked about services that have been available at PATS, they're just very brief. And I explained then that we are a federally qualified facility, meaning that we provide services to all members of the county without reference or regard to their ability to pay for services. We are currently 28% commercial insurance, 9% of our population is uninsured. We do anticipate that that will increase over time due to the removal of the subsidies for the Affordable Care Act. The remainder of our population is relatively evenly split between Medicare and Medicaid. As far as patients that come into our clinic, they are given a copay based on a means-based or financial income level that does not exceed $45 a month. And with that, they have access to all services within the organization, which those services are listed for you there. Dental, neurology, OBGYN, pediatrics, psychiatry and behavioral health, community health programs. We do hepatitis treatment now. We treat patients that have Hep C within our clinic. We also provide HIV and PrEP services. We have pharmacy services on each location. I'll not bore you with, you all can read all of that on your own. I will let you know that as of next month, we are adding another nurse practitioner to our clinic, which will allow for the ability of more walk-in services. Currently, we do have walk-in, and we will, as providers, double book. We do lacerations, IV therapy, and those kinds of services, but the addition of another nurse practitioner will make those spaces more available for individuals so that hopefully they won't have to use the urgent care clinics as a primary care site. Okay. The next thing you're going to see in your packet is about a herb that is making its way. It's been around for a while. Unfortunately, it's still legal in the state of Virginia. There is a House bill in front of the House in Virginia to make it illegal or put some restraints on it. I'm asking the committee, I'm asking you all today to consider putting guardrails on this drug. The name of the drug is kratom. It's also known as metribuzin, and it is an opioid. It follows opioid effects. It is highly addictive. And what I have found is that my patients require Suboxone and buprenorphine therapy, which we also do in our clinic in order to come off of this medication. It's also known as poor man's heroin or gas station heroin. It's an entry-level drug into heroin. It's very expensive. 4 tablets roughly cost, depending on the dosage, can cost anywhere from $30 to $80. And that's all it takes is for one person to get addicted, is one or 2 tablets. One of my patients has allowed me to explain to you their situation and how they became addicted to this medication. That individual was being treated in my clinic for anxiety and depression, went into a local vape shop and happened to explain that that was what they were being treated for. And the individual behind the counter said, I have something for you. It's herbal, it's natural, try this. And within 3 doses of that medication, that individual was hooked and came into my office. When she tried to get off of the medication, she had very standard withdrawal symptoms: nausea, vomiting, diarrhea, hallucinations, tachycardia, high blood pressure, goosebumps, all very typical symptoms of anyone that is coming off of an opioid. And it was very distressing to her. So we did buprenorphine therapy, Suboxone therapy, and were successfully able to get that individual off of that product, as well as ultimately weaned them off of the Suboxone, which was the ultimate goal, because Suboxone does have opioid principles. For severe addiction, methadone is sometimes required to help people get off of this drug. We have no methadone clinics here. Nearest methadone clinic is in Henderson or Danville. And methadone clinics require that you visit them daily to get your medication. And transportation is a big problem. Usually, when someone gets involved with these kinds of medications, herbal supplements, illegal or legal substances, it's not something that they plan to do. I firmly believe no one wakes up and decides they're going to get addicted to heroin or fentanyl or this, just like they don't plan to wake up one morning and say, I think I'll become an alcoholic or become addicted to tobacco. Follows the same principle. Counties do have the ability to limit and put guidelines on this, and I'm asking you to consider making it illegal within the county, because it is detrimental. There's information, the DEA, as well as the National Institute for Drug Addiction, as well as the American Psychiatric Association, have all recommended this drug as a drug of high alert and of concern because of its addictive properties. You have pictures of what it looks like in a storefront, as well as I've given you a lot of information about what it does, what it can do, and the dangers. Although there are not many deaths that have been associated directly with kratom, on average, there were 27,000 deaths in my research last year in the country, and among those, 0.25% had kratom within part of that cocktail. It's a concern for our children because we don't know if people are actually being asked to show identification age-wise. There are no age limits on it. Currently, 9 states have made it illegal. There are 20 states that have restrictions on it, and the rest of the states have no restrictions, Virginia being one of those. Are there any questions about anything that I've put out here tonight?
So what can the county do?
The county has the ability, and I put that information in there, you have the ability to restrict and tell organizations, businesses, that they cannot sell this product in their storefront.
And would, like the sheriff department police it, Alex, or who would police it? I mean, we can say we don't allow it, but you got to be able to police it too, I would think.
That's correct. I'd have to review the material to determine the penalties and enforcement mechanisms, but I would presume if we do have that power, that it would run the same as other substances. Now, Virginia's a little bit different than other states. Oftentimes, Virginia defaults to state organizations to enforce a lot of these rules. But yeah, the general theory behind it, if we were to have that power, would be yes, the sheriff's office would be responsible for that. But I would imagine it's probably a state responsibility.
Is this coming from distributors within the state or out of the country?
I don't have that answer, but I believe there is. It can be gotten anywhere. There are distributors within the country, I'm sure, as easily as it's able. It initially was came across as an Asian herb, and an herb from Asia, and it was initially advertised for weight loss. And energy, and but in higher doses, it attaches to those what we call mu receptors, which are the opioid receptors in the brain, and become very highly addictive. Very, very quickly, as does heroin.
Well, it certainly needs looking into.
Yeah,
but I don't know that we can fix it tonight.
No, I understand.
I think Alex needs to do some research. I think the sheriff's department needs to do some research and find out kind of exactly what direction we go in. We certainly want to keep our finger on the pulse of this.
And I don't know if when a business comes in, like a vape shop or whatever, if they come in, if they need special permits from you all or whatever, if that's the opportune time to put the guardrails in place, as well as, you know, a lot of times I understand that once something's out there, it's hard to bring it back. But I think that I think this organization is has the ability to do that with your research.
Okay.
And I appreciate your time.
All right. Thank you very much.
Thank you.
We'll now have a presentation of VCU.
Function. Good evening to everyone. Thank you so much for having us. How are we doing? I'm Sheldon Barr, the president at VCU Health Community Memorial Hospital. It's a pleasure to stand before you and give you an update. We wanted to just share with you two things that we're doing, which the first one is our pursuit of becoming a level 3 trauma program. So this is a map of the Commonwealth of Virginia. And you see with our circle where we sit that we don't have any trauma centers that are actually in our Southern Virginia area. And there are some in Southwest Virginia. You've got actually Carilion. You have some smaller level 3 trauma centers, Richmond, and up in Northern Virginia. But as you can see, this is a big gap for Southern Virginia. We're going to talk to you tonight. I have actually my colleagues both on the air medical space as well as trauma. First about trauma, then the helicopter program. Then we're going to talk about community workforce and also community education that comes with the trauma program. So as part of VCU Health System, this level 3 trauma journey that we're on at CMH is going to allow us to truly regionalize trauma care based off of the principles at VCU Health, which actually is cutting edge at a global level in terms of protocols, evidence, and research. When you regionalize trauma care, you actually decrease the risk of death or mortality by 15 to 20%, and then you also see a greater than 50% decrease in medically preventable deaths. So the needs of all of the injured patients actually are addressed wherever they are injured, regardless of whether it's in a rural community or in an urban setting, and wherever they receive care. I'm going to turn it over to Chad Springer, who is our trauma program manager. And Chad is going to give you some statistics about the locations and mechanisms of injury, as well as talk to you about what it means to become a trauma program.
Good evening, ladies and gentlemen.
Good evening.
So, start off with a few numbers. You can see the big pie up there. 55% of CMH's patients come from Mecklenburg County. Not this again.
Don't touch that.
Oh, no.
There you go.
All right, we won't touch that again. So the majority of the patients do come from Mecklenburg County. The greatest percentage of our trauma patients are fall victims, and that's due to the elderly population that we do have. About 12% of our trauma patients are motorcycle and motor vehicle accidents as well. So those are our biggest numbers that we deal with on a daily basis. So a little bit about trauma centers in general. So what we're applying for is going to be a level 3 trauma center with the goal of having a regional network that will coincide with VCU main campus. They're a level 1 trauma center, so they're able to have all the services that are needed 24 hours a day, 7 days a week, that will allow for anything from open heart surgery that you can deal with major gunshot wounds and all those things. They have thoracic surgeons, whereas for a level 3, we won't be able to have all of those specialties at CMH just because of our volume and our size. So, but we will, the main goal behind the level 3 trauma center is that, as she showed the picture of the circle, in the trauma world, we consider that to be a trauma desert. So we don't have accessibility to capabilities of the level 1 trauma centers or the level 2 trauma centers. So what a level 3 trauma center's main focus is to receive a patient in a timely manner and have life-threatening situations resolved, and then possibly transport, or if we can't keep them after we have resolved the problem, transfer them promptly to the level 1 trauma center for tertiary care. This slide just kind of demonstrates the coordination of the trauma center. So the hospitals, you have an advantage of the trauma network, the coordinated systems between the hospitals and emergency services, which improves patient outcomes, improves access, enhances patient and family support. One of the things we're looking at doing is, if you are traumatized and you have to be transported to Richmond for tertiary care, we're going to try to get you back to South Hill in a timely manner so you can finish your rehab here to decrease the burden on the families. The other main thing that this trauma network will allow us to do is to enhance quality improvement and opportunities for research. So being involved in and networked with VCU in the level 1 center, that allows us to bring these opportunities to CMH here locally for our patients as well. So the journey began back in 23. The VCU Medical Center Trauma Department and VCU CMH administration got together. They performed a gap analysis to figure out what holes we needed, what we didn't have, what we needed to acquire to set out for this journey for the level 3 trauma center. And with that, we found out that we did have some equipment disparities that we were able to find funding for and get purchased. In late 24, the lead acute care trauma APP was in place, and the trauma program manager was hired as well. That would be me. 2025, we've been coordinating with the service lines, with the OR, the emergency room, anesthesia, blood bank, all the key players within the institution to get everybody on one page to say, hey, this is where we're going and this is what we need to get there. So those guidelines, policies, and procedures, they're still moving. We're still making that happen. Back in May of 25, we actually got to start having trauma team activation. So with this, if you've ever been in CMH, you've heard overhead pages about stroke alerts or whatever type of alerts it is. With the trauma team activation, that brings together the core team members that may not be in the emergency room at the time. So that would bring in respiratory, anesthesia, surgery, and all those people to the patient that meets that criteria so that they can start that care in a timely manner. And this allows for either the damage control surgeries or either a prompt transfer out, if that's what need be. So currently we have, and with the expansion of this service, we have been able to acquire a little bit more staff. We've got 5 full-time VCU EM trained ED physicians among the others that have come from other places. We have 7 part-time VCU emergency medicine trained ED physicians that they work at main campus in the emergency room on a full-time basis and then locum down to our hospital to fill in some of the scheduling gaps. And we have 3 general surgeons on staff currently. The good thing that's coming is in summer of this year, we have 3 full-time VCU EM trained physicians that are finishing up fellowships currently that we have been able to hire, and they will start with us probably in July to August, which is a huge benefit. And then the most exciting thing about it is we have 2 full-time dual-boarded acute care trauma surgeons that'll be joining the force in early fall. They're finishing up their acute care training now, and they'll be done in July. So what that allows us to have is they're already general surgeons that have gone forth and done gotten boarded in medicine as well, so that they have both aspects of the patient care device. And now I'll hand it over to Dempsey Witt, who is the operations manager for Life Evac.
Good evening, Board. Thank you for the opportunity to come and just share with you a little update on our program. As Chad said, I'm Dempsey Wood. I'm the program director for VCU's Emergency Aviation Program, and our call sign is Life Evac. I hope you saw that. If you've been by the hospital any time in the last month or so, you probably saw our helicopter sitting on a pad over there. We are in service as of February the 4th. We went in service shortly thereafter, did our first flight out of CMH. It's a pleasure again to be here to offer this update. I just wanted to share with the group. This journey for me started 5 years ago, and shortly after I came to work at VCU, I started reviewing the data and saw the number of times that we came down to Mecklenburg County to CMH, to scene flights, and so on and so forth down here, and the numbers were just astounding. We fly a lot of numbers, as Chad pointed out. It's kind of like an island for trauma here, and I've been working on this for 5 years. So I can't tell you how excited I am for us to be in service and serving the citizens of Mecklenburg County. Just a little map here to kind of show where we're at and in contrast with other locations in the Commonwealth and some of the distances we fly there. So having an aircraft here saves us to 35, 40 minutes, 50 minutes, depending on what aircraft is coming here just to fly down to South Hill. So we're able to get that patient that much quicker and get them headed to where definitive care is. I will say that the citizens of Mecklenburg County are extremely fortunate in the EMS system that you have here in the county. We're here to be a supplement to the county. I've worked with Gavin. We've worked with Gavin and Justin both. We want to be a part of the EMS system for Mecklenburg County. We want to train with them. We want them to train with us so that whenever they need us, it's a seamless transition of care from them to us. The main thing that we offer that they don't offer is that speed. You got phenomenal medics. You got phenomenal care providers out there. It's just the speed of getting them to a trauma center or getting them to a PCI center for a heart attack or getting them to a stroke center, whether that's here in Virginia or whether we need to go to south to North Carolina. We currently can fly patients to North Carolina or North Carolina or Virginia. We are in the process of obtaining our North Carolina EMS agency license, so we would to go into North Carolina and fly patients from point to point in North Carolina. We can pick a patient up in Virginia, fly them to Duke or UNC, wherever they need to go. I've made it very clear with our staff here and with Gavin and Justin both. Again, we want to be a part of the system here in Mecklenburg County. We are currently in a couple of phases of operation. While we are operational, ultimately this is what you will see on the campus at CMH. That's the current helipad. As you notice, then the hangar will have a hangar and everything there. We're in the process of building a second helipad on the campus, and then we'll have an operational. We need that helipad before we can start the hangar. So we're in the process of doing that. Just this first month, a couple of highlights. We flew 28 patients from February 4th to the end of the month of February. We flew 28 patients. We also transported 5 patients by ground when we did not have weather to fly. So currently, if it's poor weather, then an ambulance would have had to come from Richmond, or a patient may not have had the best optimal patient care to transport them back up to Richmond. So we have an arrangement whenever we know we're going to be out of service for weather, we get a ground ambulance assigned to us there at the hospital. So if there's a flight request and we can't do it for weather, our crew gets on that ambulance. We transport the patient to Richmond or wherever they need to go. And we did 5 of those already since we've been in service. Long term, our plan is that we will have what we call an instrument approach, which means that in bad weather, we would be able to fly those patients. Some of those patients we would still be able to fly that we're not able to right now because of weather. But we're working to get an instrument approach there at the hospital so that they would be able to all of our pilots are instrument rated. We just don't have the approach yet there to be able to do that. But ultimately, we will be able to fly some of those patients as well. Thank you.
All right, so adding back on to the level 3 trauma center journey, that comes with a lot of community collaboration and workforce development initiatives that are there. One of the big ones is Project Impact. So this is a National Highway Traffic Safety and Virginia Department of Motor Vehicles granted program that funds this. What this does, it reaches out to high school students and they get really exposed and have a big program about injury prevention, about irrational behavior as a kid, impaired driving, distracted driving, teen dating violence, and bullying. So the members of this team, they get out into the schools and they talk to students about this. But the biggest thing they do is what we in Mecklenburg County have previously known as a prom promise kind of deal. So they get together and they put this big mock scene on just like this in collaboration with fire and EMS. And they come in and they show the victims that are in these accidents in a mock disaster or mock accident. They get to do the extrication on it. The students get to see these patients taken out of the vehicle. And then it kind of turns over into a emergency room scene in the gym. As you can see, 88.3% these students reported presented changes in their perception of impaired and distracted driving, which is a big number. 98.9% reported students greater understanding of the potential choices and consequences related to impaired and distracted driving. So when you get into this, and the pictures on the right-hand side of this, it kind of goes into what the kids see. So they're standing out there, and somebody's moderating this event as it goes on, so they're just not wondering what's going on. It's being moderated and emceed, and they get to see these their actual students that are simulated up that have been in the crash, and then they're removed from the vehicles, and then they're taken to the gym, and then an emergency room operation goes on in there. So they really work through this. It's the team of nurses that come in there. They get all garbed up in their personal protective gear. They act like that they're working on the patients, and ultimately one of them does not survive. And having seen one of these, I've actually had the opportunity working in a different role to participate in these, and having seen these kids, and they'll go from chatter to complete awe. The gym will go silent. You'll hear some of them sobbing and crying. It's really, really a good program for these young people to see. As you can see, over the years, they started back in 2012. There was 4 schools and 49 students that had seen this program. Back in 45 schools, 19 school districts, and over 42,000 students have been able to see this throughout the state. And we're bringing that here to Mecklenburg County to help as well. We have 3 team members. We actually have a coordinator that's assigned to CMH now that is starting to roll these programs out. Some of the upcoming initiatives that we're doing with this Level 3 trauma designation is one of the big things is we're providing a rural trauma team development course. So this is a course that's developed by the American College of Surgeons, and it's designed to get out into rural areas to show and outline the need for a strict, enforced regimen about how trauma patients are seen in the emergency department. So a lot of the times in places that don't have the resources, somebody who's in trauma may not be attended to in a timely manner for whatever reason. So just like any other time-sensitive illness or injury, such as a heart attack or a stroke, the priority in the ER is to get these people that are having these signs and symptoms and have them looked at and medically evaluated to see which way we need to go from there, whether it's a continuation of care with this patient or they're not that seriously sick or injured and they can but they can not be an emergently treated like a trauma patient who's bleeding out that needs the resources to them to save their life. It was initiated back in 2023. VCU Trauma Center led this initiative for the state. They've had partnerships with 4 other systems across Virginia. They've expanded it throughout the western part of the state, the eastern part of the state, and to the southern part of the state. We've had 3 classes so far at CMH, and we've had 53 participants that have participated in that locally. So these aren't people that came from anywhere else. They were within the surrounding counties, employees of CMH or first responders in EMS as well. Some of the other things that we're providing at CMH, we're going to be providing some OR clinical experience for the Mecklenburg County EMS RSI program. So this will allow them to get into ORs at CMH and perform live intubations on patients for practice and for skill proficiency. We also have some instructors from CMH that are going to be helping with the upcoming EMT class that the county's putting on. We also have 12 certified Stop the Bleed instructors that have just been certified to do this, and we're planning some community outreach events. And what Stop the Bleed is, that's a national coalition that's also aligned with the American College of Surgeons, and you go out and you provide short, life-saving hemorrhage control interventions to citizens, to lay people. And in our areas with farming, agriculture, and forestry, and the Microsoft industries, that is crucial because it only takes one good laceration to put you in harm's way. And getting that hemorrhage stopped is one of the biggest things that you can do to save their life. We also have EMS Week coming up in May. We do that. We participate in that every week in conjunction with Life Evac. We celebrate all our EMS partners that are in the county and surrounding counties. We offer some different things for them, including some meals and also some continuing ed training that they need to have to maintain their certifications. And as we spoke earlier in the presentation, our major contributor of trauma is falls. We're working with Project Impact and the fall prevention from VCU main campus to get out in our county and areas and implement some other fall initiative programs to hopefully reduce some of these. And then we also have another rural trauma team development course coming up April 27th at CMH again. So also one of the initiatives we have is developing young people getting interested in healthcare careers. So developing hometown healthcare heroes. Many of you have already heard of the Career Scene Investigation or CSI camp that we do at CMH every year. We take a number of middle school 7th and 8th graders, and basically they get to run through the whole hospital, see every nook and cranny of it, participate in different things such as CPR. They get to see the hazmat decontamination tent put up, and they get to do a mock decontamination. They get to just all types of different things. It really opens their eyes up. It's a really good program to get them interested. And we've had people that have graduated from this CSI camp that have came back and worked at CMH after the fact. So that's the goal, is to keep them interested and get them back to the workforce into the county. This is kind of my highlight. I got asked very early on when I got hired to help with this program. So there's a dual enrollment EMT program that's a partnership between CMH Workforce Development, Mecklenburg County Public Schools, and Southside Community College. So there's 7 students that are involved in this. One is a Charlotte County resident, and the other 6 are Mecklenburg County residents. They go to classroom at the Estes Center in Chase City Monday, Tuesday, and Wednesday on their first block. And then on Mondays and Fridays, they come to CMH for clinical rotations throughout the hospital. So traditional EMT students in regular classes, they really only get to maybe go ride on the ambulance for some clinical time and maybe come to the emergency department for a little while. These students that are coming to us, they have been from the emergency department, the ICU, the acute care setting, have shadowed radiology, they have shadowed sonography, We're in the process of changing these rotations and the lab and respiratory and pharmacy, and we're in the process of changing this up so that they can follow advanced providers, physicians, nurse practitioners, and physical physicians assistants so that they can look at the specialty areas that each one of those has contact with so that it sparks an interest. I can tell you that 2 of them have changed their mind about what they wanted to do. One of them came in and said, I want to be a registered nurse. Now she wants to go to radiology school. The other one, he wanted to be an emergency room physician. Now he wants to be a trauma surgeon. So, and he's asking about going to shadow at main campus with the trauma surgeons up there. So, and all these students are graduating this year. I know 2 of them have been accepted to VCU in a medical field. And 2 of them are undecided, and 1 is getting a full ride to a college for wrestling, as a matter of fact. So she happened to win 2nd in the state last week. So those guys are getting a real good opportunity to see the inner workings of a hospital, to really collaborate with the nurses, doctors, all the ancillary services. The radiology one is the one that these kids really like to look at because they have never seen the inside of a body through radiology. We've got a really good radiologist over there that spends a lot of time with them explaining how to read a CT scan, where all the body parts are and what they look like. But that's a picture we did Friday. We got a tour with the Life Evac crew. They told them all about emergency aviation, and that sparked some interest as well. That is it for me. And I'll turn it over to Shell.
Well, I know we've taken up a lot of time, but I think that what I'd love to just share is trauma rises all tides. Trauma is a team sport. Trauma is a community sport. So trauma touches more than just trauma. And out of this, from a jobs perspective with the trauma program, we're infusing no less than an additional 14 to 20 additional jobs into healthcare. Figuring out those hometown heroes is certainly important to us as we build. It's social work. It's adding resources to respiratory therapy. It's the lab where we've added resources to blood bank as well. But I do want to end with just giving credit to Mr. Tanner. The slide that we had, he sent me an email early on in my career at CMH asking how we could be involved with the EMT students and asking how we could do some things that Carillion actually had done. So when Chad joined, and Chad was just that right person to get him off the aircraft and bring him back home to right here to Mecklenburg to build this program up. This was really something that Chad ran with off of that email. And I'm so excited about where this is going to go. These students have seen things that no other EMT students have seen across the Commonwealth of Virginia with the collaborative effort here. So we look forward to doing more of that. And thank you so much for having us. Any questions for us?
Absolutely. Thank you. Any questions?
No, I just got a comment. Thank y'all. Thank y'all for having the vision, especially getting the helicopter here. I mean, that's huge for this area, and everything you're doing with getting a trauma center here is going to be a great benefit to all the citizens of not only Mecklenburg County, but the whole area.
Thank you. And they've flown a 5-week-old baby out of not even our hospital that, you just think that who would have flown this baby with our very tenured team. They have touched, and those, 28 is a number, right? But it's 28 individuals. And one of those ground transports was a paramedic and an emergency medicine physician who 3 years ago got on the aircraft together when they were both in training, who actually said, whoa, we're big kids now. We're actually taking care of this heart attack patient, and they did it together. And that's how we attract and retain this top level talent that comes out of ECU to practice down here in Mecklenburg. So thank you.
It's absolutely wonderful, I can tell you.
Thank you.
Thank you. Alex, these utility sites look like we talk about them every month, but I think we got some resolve going forward. I'm going to let you work on that. Let's talk about that.
Okay. So just as a reminder for everyone, we have a number of sites that were deeded to the county over the years whenever residential development was proposed. These sites were intended to be dumpster locations. Since we have moved away from that model, these sites are no longer necessary for us to hold and could be put back into the community for much more productive uses. The property committee previously allowed the Board of Supervisors to have time to determine whether they wanted to list some of these properties for sale by auction, or if there was other people who would be worthy recipients of the property without it going to sale. Last month, you all decided to give yourselves another month to consider these sites and their disposition, and that's where we rest right now.
Okay. So, have we got to have another public hearing on this?
We will have to have a public hearing to dispose the sites. That is correct. Next month would be the optimal time if everybody is ready for that.
According to the emails I read. Okay. All right. So, anybody have any comments on this?
No, I think we've talked it.
I think we
just
definitely
need
have
to
worked
move
it over
along.
pretty
Yeah.
good.
So
Move along
so
with
we
the
will
process.
we'll definitely have a public hearing, which is a more generic hearing. The intent right now is to list all of the properties, no matter whether they are for sale or by gift, in the ad, just so that we're covered in all cases. But we still, if there are any properties that you all think should be reserved for somebody, we will need those transmitted to us, so we can get about the work of making sure that they don't go into an auction sale and are deeded by gift.
But we put them all in there, and then, like I said, if we got one or so, we just contact the staff and y'all can
Yes,
separate that.
that's correct.
At another
Yeah.
date. Yeah, okay.
Okay. All right. Very good. So we'll finish that up next month. And next we go into an appointment for the Lake Gas and Weed Control Council. I think we carried that over from last month.
You did, Mr. Chairman, and I reached out to several folks and I sent Mr. Gottschalk an email back, and Mr. Chad Barber is willing to serve. He would be the alternate on it. So I will make a motion that we put Mr. Barber on there as the alternate.
Everyone has heard the motion to appoint Chad Barber for the alternate on the Lake Gas and Weed Council. All in favor say aye. Aye. Opposed? And the motion carries. Next, we're going to go to public comment. Jenny, have you got the list? I would like, while she's getting the list, I'd like to remind everybody, you got 3 minutes to talk, and the board does not engage. Nobody's on it? Brent? I didn't mean to read those rules to you, Brent.
I just, on behalf of the sheriff's office, thank y'all for coming to our banquet. Hope you learned something, saw what we do, and if the people in the community, ask what we do, and y'all come in y'all district. We hope we do a good job. We think so.
You're doing an excellent job.
Just wanted to thank y'all for coming.
It's a very noticeable that you've got some highly qualified employees and deputies in the county.
Y'all heard me say we're fully staffed.
Yeah. Yeah, that's.
We thank y'all for that from last year. So just want to say thank
they love Mecklenburg County, and Mecklenburg County loves them. I can tell you that now.
Yeah, thank y'all for everything.
Thank you. Personnel Committee report. Ms. Blackwell.
A meeting of the Personnel Committee was held in and for the County of Mecklenburg on February 9, 2025 at 12 o'clock p.m. in the Board of Supervisors meeting room of the Good Bank Building. The meeting was called to order by Chair Blackwell. Members present: Brenda Blackwell, Chair; Claudia Lundy, Sterling Wilkinson, Tom Tanner. Also present: Jim Jennings, Dennis Spence, Andy Hargrove, David Brankley. Upon motion of Claudia Lundy, the board voted unanimously to convene in a closed session for discussion of an item. Upon completion of the discussion, upon motion of Sterling Wilkinson, the board voted unanimously to reconvene in open session. Upon motion of Tom Tanner, the board voted unanimously to adopt a certification resolution of the closed session. Upon completion of the reading of the certification and there being no further business, the meeting was adjourned.
Okay, so no action on that. Thank you, Ms. Blackwell. Next, we've got the Agricultural Development Committee report. I will be handling that one. for the last time. The Agricultural Development Committee met on Tuesday, February the 24th, 2026 at 6 p.m. in the Dogwood Room, 313 Franklin Street, South Hill, Virginia. Members present: Jim Jennings, Chairman; David Brinkley, Sterling Wilkerson, Taylor Clark, Mark Moody, Bill McBride, Chris Jones, Mark Warren, Irvin Matthews, Mark Brinkley, Chuck Nelson. Members absent: Brian Calhoun and Chris Ramey. Also present: Andy Hallgrove, Brenda Blackwell, Tom Tanner, Kirk Gravitt, Dennis Spence, Avery Lane, Candace Wilson, Davey Harris, Michael Lax, Jim Rydell, Maggie Breakville, Alex Gottschall, Judy Sheffield, and Jenny Whittemore. Chairman Jennings called the meeting to order. Mr. Lax gave an invocation. Mr. Jim Rydell, Chairman of the Agricultural Forestal Rural Preservation Committee of Louisa County, Virginia, introduced the guest speaker, Mrs. Maggie Breakville, Land Development and Agricultural Conservation Coordinator with Louisa County, Virginia. Ms. Breakville presented options for land preservation in Virginia. During her presentation, she highlighted several approaches, including zoning, land use taxation, agricultural and forestry districts, conservation easements, purchase of development rights, and transfer of development rights. She compared the different methods by outlining the benefits and advantages of each, as well as the potential drawbacks and impacts associated with their use. Mr. Taylor Clark provided a report on the activities of the Virginia Cooperative Extension, including update on the Extension Office's 4-H program, including information on the upcoming camps. Mrs. Candace Wilson provided the committee with an update on the Farm Service Agency and highlighted current programs available to the community. Mr. Davey Harris presented an update on the activities and initiatives of the Natural Resources Conservation District. Mr. Avery Lane discussed current programs and ongoing efforts of the Lake Country Soil and Water Conservation. At the conclusion of the meeting, Chairman Jennings announced that he would be stepping down as chairman of the Agricultural Committee. He stated that the position of chairman would be assumed by Sterling Wilkerson, with Kirk Gravitt serving as vice chairman. There being no further business, the meeting was adjourned. So that's for informational purposes. Congratulations, Mr. Wilkerson.
Thank you, Mr. Chairman.
I've been doing that for a long time, so I felt like it was time to hand that over. Okay. Alex, I think you're up next.
The first item we have for you is the purchase and sale agreement for 401 Madison Street. The auction for this property closed last Tuesday night, and we did have a successful bidder. The high bidder for the property was Alexander Rolls, and we are now proceeding to work on the closing in order to transfer the property to Mr. Rawls. His winning bid was at $51,000 for that facility. In reviewing some of the plat material, it has come across that the building a small portion of the building actually encroaches onto the property where our 911 center is housed. And so we are going to work with Mr. Rawls to make a modification to the property lines in order to make sure that the entirety of the building is on property that he will purchase, and then also that there will be the ability for him to walk beside the building and not have it be immediately on the property line. So we do have to obtain a new plat, and we will adjust the boundary line accordingly. At this time, the board would need to adopt a resolution, which is in your, believe is in your packet, that would do those things, that would agree to the sale to Alexander Rawls for the amount of $51,000 and would secure the new plat and would work with him to adjust the boundary in order to make sure that everybody can go next to their buildings and not walk onto somebody else's property.
I totally agree with Alex and all. I'd like to put that in a motion.
Yeah, I do too. So, all in favor of the motion, say aye.
Aye.
Opposed? Motion carries.
And we were very, very excited to have that building become something that would be more useful and productive for Boyden and for the county and for everybody else. So,
Yeah, this family has a history of taking these buildings and restoring them. So I think it will become something nice.
Very good.
all right. The next item we have for you is the announcement of the bids for the public safety building. That occurred on Friday afternoon. It was a burst of excitement around here around 3 p.m. On Friday afternoon to see how many bids we were going to get and what the numbers were going to be. Ultimately, we did receive 6 bids for this project, which is a good, healthy number. Just as a comparison point, when we did the expansion of this building, we only received 2 bids. So we were able to generate a little bit more traffic and a little bit more competition for the public safety building, which is fantastic news. At this time, I don't believe we are in a position to award that bid. I do think we do need to do a little bit more evaluation on all of the items that were presented therein. But the apparent low bidder is KNA Contracting out of the Roanoke area. They had a bid of $25 million, $374,471. I would remind everybody that bid refers to only the construction costs of the facility. There is a number of other costs that are above and beyond that amount as part of the total project. So that doesn't include things like furniture and technology and commissioning services and special inspection services. And so there's a number of things that will make that project, the total project cost, ultimately be north of that. But this is what the construction amount will be, is in that range. Kenbridge Construction Company came in second. There was a differential of about $600,000 between the low bid and the second bid. And then English Construction Company was third, H.G. Reynolds was fourth, Cooper Tashio was fifth, and Carlson Brothers was sixth. All of the bids were within the estimate that Mosley had for the construction cost, so we thought that was a very favorable return for us. Just to give you a sense of what we need to do next, we do have the knowledge of who the apparent low bidder is, but we need to go through and make sure that everybody submitted all of the documents that they needed to submit, and then we also need to check and verify that everybody who submitted has a favorable work history to make before we award some building of this level of scope and consequence.
Makes perfect sense.
So we will hopefully be in front of you next month to actually award this contract.
Does that have to go through a vote of the property committee to award that or not?
It doesn't have to. If you guys would like for that to happen, we can certainly do that. The Emergency Services Committee has had this project previously and have kind of shepherded this one along.
Okay.
But if you all feel like the property committee needs to award that, then
I certainly would like probably a blessing from both those committees, to be honest.
So you want it to be awarded?
Next month.
Yeah. Next month. Okay, for next month. We'll move to
You just want to vet the companies.
yes, that's correct.
Yeah.
To the meeting, we'll just do it prior to the property committee.
Okay.
Yes.
Would we potentially be able to get an estimate on what all the other stuff would cost? Just a rough estimate? Would that be possible?
Yeah, we have it. That's why we budget for the total project costs in the CIP we adopt every year. So the overall total project for this is going to be probably around $35 million.
Okay. So another 10.
Yeah, some of that is contingency, which we hope we never have to spend, but you don't know going into a project what will happen. And some of that was the architectural services, which we've already spent that money. So that design contract alone was $2.4 million. So we've
and we can't shut down the 911 center. We have to basically duplicate it in the new building and make sure it works before we can.
Yeah.
The other one will just move some
So,
stuff out.
so a considerable amount of those costs are either things that have already been done or may not happen. But the rest of it, the furniture and all the technology and all that stuff, probably would come in, I would say, around that $2 to $3 million range is ultimately what it will look like. But we have $35 million set out in our budget, in our adopted budget, for the total cost of this project, and that project will be fully funded. So it's there and ready to go when we can commence construction.
All right, thank you. All right, very good. General Assembly.
Okay.
Fun stuff.
Yes. So we are now in.
Yeah, there you go.
We are now in the.
3 minutes.
Perfect.
We're in the final week of session, which is always a incredibly exciting time, but it's also a very volatile time, and there's a lot of unknowns going on this week. There's conference committees meeting in every corner of the building whenever they get a moment to. As of earlier today, there was already 65 bills in conference. The budget bill isn't released yet, and that's in conference. There's almost 500 pieces of legislation that have been passed that have to go to the governor for signature. Right now, 7 of them have been actually signed into law. There was a handful of governor's recommendations, but the vast majority of them have not actually been transmitted from the General Assembly to the governor, even though they've been passed. They've been holding them and stacking them on the desk to wait till they're out of session to send them back, to give the governor more time to make decisions on what she wants to do with those bills. So very fluid time right now, and still not a lot of certainty. That being said, there are some things I wanted to bring forward for your attention. One bill in particular that we discussed last month, I wanted to report the fate of that one. That was the housing targets bill. Fortunately for us, I would say, that bill has met its demise. The patrons both struck their bill, the Senate before it was considered by the local government committee and then the Senate as a whole. The House bill actually passed through the House, but then was stricken at the request of the patron in the Senate local government committee. So that one was avoided. So we will not have to, for the moment, comply with any housing growth targets mandated by the Commonwealth of Virginia. So I was relieved to not have that be imposed upon us. Otherwise, most of the other bills we've talked about previously are still in either waiting the communication from the governor, or have not had a final resolution at this time. And so, like I said, there's a lot of uncertainty. There are 2 other bills that I did not talk about last month, but I did want to point out to you all to consider as we progress. Number 1 is game of skill legislation. For those of you who are unfamiliar with that term, the game of skill is a device that you will find in gas stations, convenience stores, sometimes standalone facilities, where they're almost like mini slot machines, and people can test them and can win some amounts of money. I really wouldn't know since I've never done it, but presumably you can win something, otherwise people wouldn't participate. But those have been an issue that has been heavily debated in Virginia over the last few years, whether they were going to be permitted, not permitted, banned. To your question earlier, whether the sheriff's office would have to go bust them down from every gas station in the county. I think the General Assembly has finally come to a place where they are likely to permit them going forward in the Commonwealth. However, the way the legislation currently reads is that it would be allowed for every county to make their own decision on this matter. So each county would have to have a referendum in order to permit or not permit the game of skilled machines being used in their county. And generally, when it comes to referendums, the process is that you all have to request the referendum be held. So that will probably be a decision that you'll be faced with sometime in the summer or later this year. It would be too late to have it this year, but in a future year, you'll probably have a request from the owners of those convenience stores and gas stations to put a referendum on the ballot to see if Mecklenburg County would like to permit or not permit those devices. So that's something to start thinking about how you want to approach that going forward. In a similar regulatory item, marijuana. The retail sale of marijuana is also likely to be something that is going to come out of this General Assembly session. The bills in each chamber have some substantive differences. So that's one of those committees that conference committees that's working to resolve matters. Unlike in the past, there is no referendum component as part of the current marijuana bills. However, there is a requirement that the local governing body would have to adopt an ordinance in order to set a tax rate on those transactions. The tax rates in each chamber currently differ, so that's one of the big things they're reconciling. Nevertheless, that is something else that this board will have to consider, is whether you want to impose a additional tax on marijuana transactions, should we have any establishments ultimately open here in Mecklenburg, or if that is something that you don't want a tax imposed on. That's going to be a choice that will have to be made. So another thing to think about as we go through the next few months, next year. It's not going to be an imminent item in the sense that there is going to be a controlling factor in the state level. They're going to create their own cannabis authority, or it may be placed under ABC. We'll see how that goes forward. But either way, the licensing of the actual establishments will run through a regulatory authority of the Commonwealth. So we won't have to make a decision on whether to permit or not permit dispensaries, but we will have to decide whether we want to tax them or not. So those are two things to start getting your minds around what choice Mecklenburg County will want to make on those matters. Other than that, I really don't want to belabor things too long tonight, just because there's so much uncertainty that I feel like if I say get into the weeds on any particular bill, then they're going to report it tomorrow, then they're going to strike half of it, and then it was like, why did I even bother? So that's really where we're at right now. Is the next few days are going to be a lot of tracking. And then ultimately, the budget's going to come out towards the end of the week, and then this weekend they'll have their final votes, and we'll proceed from there. So, unless there's any specific bills that anyone wanted to update on, but that's kind of the high-level summary. Is a lot of hysteria right now.
Okay. Very good. And your staff reports. You going over that next?
Yeah, those are in there.
I guess nobody's got any questions on Jones.
Yeah. No. Okay. Yeah, the staff reports, the same customary reports are in there. Don't have anything in particular to call out at this point.
Month also.
We had a small amount. We had a part-time buildings grounds person who was onboarded. We did have a retirement this past month. Debbie Harwell, who was up front here, retired. And so we are currently advertising for her replacement, and I will share with you that we have over 100 applications as of today for that position. So things are going well on that front.
Mecklenburg County is a good place to work right now.
Yeah, we need to keep it that way. So
yeah, I agree.
That's anyway. That's the big thing that transpired this month. So on hiring and in the staff reports.
Okay. That all you got?
Yes.
All right, very good. Y'all had consent calendar. I noticed that took a little while to get uploaded. I didn't.
I sent her an email, don't worry.
That's how you got one. Okay.
I wonder what was going on, because I looked at it, I said, well, I don't know how we're gonna approve this, and we ain't got it. So
We didn't spend.
that's gonna be a tough one.
We didn't spend no money.
We'll keep you straight, don't worry. Yeah, right. All right, I'll entertain a motion to approve the consent calendar since we've got it.
So moved, Mr. Chairman.
A motion been made, all in favor say aye.
Aye.
Opposed, motion carries. All right, down to board member matters, we're coming on down to the close here. Mr. Tanner?
Thank you, Mr. Chairman. First, I'd like to thank VCU on that presentation tonight. I think that was it's a huge win for this area. It'll be huge for the population of this area and the surrounding areas on that. Also, the dumpster site in Bracy, as I've talked to Alex, if we can get the asphalt plant open back up so we can get some asphalt laid down there, hopefully we will have that site open very soon. Had the pleasure last week of going to the SVCC Awards banquet kind of thing they had at 313 for the Microsoft students they had here from the military. All of these were either veterans or current military members that came here for training. Some of it was virtual, some of it was here. But I would say there was probably...
I think there was 75 or so in that program.
And it's grown every time. This is the second year they've had it, but that's a tremendous program for the college and this area to have those people being trained right here. Also, I'd like to thank Justin and his group. They were helping take care of our fire departments this week. They were doing hose testing, ladder testing, and pump testing for all of the fire departments in the county this week. It's something this board voted to help those volunteer agencies out with, and it ensures that everything is up to date and current and safe to be used. And I know they did a whole lot of running up and down the road this week to try to make sure all of that happened. But I thank this board and Justin and them for supporting the departments like that. Remind everybody that the 4 o'clock burning law is in effect, so please don't burn anything right now. And Jeffrey did an excellent job on supper.
Absolutely.
That's all I got, Mr. Chairman.
Thank you, Mr. Tanner. Mr. Wilkins?
Thank you. Yeah, he got most of what I was going to say, but just, congratulations to the 3 individuals who received the resolutions. That's very distinguished.
Mm-hmm.
Yeah, 100 years old, and then Mr. Crump for serving for so long for this county. We really appreciate all their service. And just to go back to what he said, for the trauma center, it's hard to believe that this is real life. What this area has done in the last 15 years. It's just a testament to this area, how blessed we are, and it's going to really, pave the way for the future with us. So that's all I have.
All right, thank you. Ms. London?
First of all, I'd like to congratulate, we have gone now, the citizens that turned 100. I think it was about 10 years ago when I put that in a motion to give people who turn 100, 100, give them a resolution. And I think we have had almost 100 already. They have come across here to get a resolution, but congratulations to those who did come tonight. Project Impact, I think that's a great program for the young drivers, not only in Mecklenburg County. I think it should be all over Virginia, all Southern Virginia, all over, before they can get their driving permits in high school. I think some of them get them at 15 and 6 months and 16 years old. I think they need to go through this program before they get their real license. The trauma presentation from VCU was excellent. I can attest to that because my husband flew out, had to get a plane from a helicopter from Bond Secure to come and take him to Richmond Hospital December the 5th in emergency. VDOT, congratulations. I called them and they were there less than an hour to remove a deer in the road in front of my house, and it was real hot on Friday. It was real hot on Friday. I didn't want the deer to stay there all weekend.
I thought the chairman of Secondary Roads did that kind of thing.
Yeah. She called Kay today, I think. Did you?
Thank you. Thank you. Ms. Blackman?
Congratulations, to those who were recognized, Ms. Crowder, for her 100th birthday, in memory of Sam Bug and Mr. Crump upon his retirement. The recognition by SVCC for those graduates and for the military transitioning out and what they're doing, that was simply phenomenal. The Trauma Center, the upgrading of CMH, and when they joined with VCU, so it's really enhanced the perception of community hospitals. So now there's one thing I want to ask about, and I think I'm a pretty good driver in South Hill. When you are coming out of the Roses parking lot, coming out of there, and then the opposite side, you're coming out by Pizza Hut. At that light, the lanes, you can easily collide with another car, because the turning lane and the coming straight, you meet each other. That's quite dangerous.
I've had the same thing, seen this.
I've seen it happen, yeah.
Yeah. So what y'all gonna do about that?
We need to ask the VDOT guy.
That's a primary road.
Secondary roads.
If it helps you, Kirk, the answer is the town of South Hill has responsibility for roads in the town of South Hill.
That is really dangerous.
Wrong council.
I agree with you.
Yeah, it is kind of a little confusing there.
Is that all you have, Ms. Black?
Yes.
Okay. Mr. Spence?
Thank you, Mr. Chairman. I too want to echo congratulations to those people who received resolutions. Also, thank you to the person that was making the presentation from the past. That's very informative information. I think we need to do the research on that and everything and make a decision. Also, wanted to honor to have VCU provide all these different services that we've been talking about VCU and helicopters and this kind of thing for the last couple of meetings, and to hear about programs and that type of thing. What an honor to have that kind of activity going on here in Mecklenburg County. So I think that's a great thing. I also want to comment that we are in an election. We have an election going on, so I would encourage citizens to get out and vote. I've gotten a few calls this month about the election that's coming up, and it's concerning redistricting. And so I would like to encourage citizens to get out and vote, and not only vote, but I encourage you to vote no on redistricting. Reason I say that is because these redistricting plans could have an effect on lots of different things. So this kind of vote will help you take a position on some of the following things. No on abortion, and I'll just call abortion what it is, killing babies. No on boys and girls bathrooms. No on higher taxes. No to higher energy costs. No to indoctrination of our children in public schools. No to taking away your Second Amendment rights with all these new gun laws. I will tell you that some of the gun laws that I have listened to, they're not going to have an impact on criminals at all. They're going to have an impact on citizens who are law-abiding citizens. And also a no to hound hunting. So I know there's been quite a bit of talk about the hound hunting and that type of thing. So again, get out and vote, exercise your right to vote, and I encourage you to vote no on this question that's about the redistricting. I also wanted to comment, I want to thank Sheriff Hawkins, who has taken a public stance on Second Amendment rights. And so I think that's very encouraging to hear him come out publicly and state what his position is on Second Amendment rights. And that's all I have, Mr. Chairman. Thank you.
All right. Thank you, Mr. Spence. Mr. Grady?
Everybody drive safe, I reckon.
We'll let you know, but I promise.
Y'all got all the thunder.
What happens when you go last?
I ain't lying.
Yeah, well, they got mine too, so don't feel bad.
Thank you to Sheriff's Office Banquet, y'all. You had I really enjoyed it. Thank you everybody for the everything, the services, everything y'all do for the county. Once again, Life Evac, what a great asset to the county. Once again, one thing I forgot to ask Alex. I know we didn't ask earlier, but what is the status of the collective bargaining?
So that bill is currently one of the bills that is in conference, very likely to pass. There are certain differences in the enactment clauses between the House and the Senate right now, mainly governing when it would come into effect. But that's what the status is. The status is likely to end up advancing out of the General Assembly.
All right, and if it were to pass under the provisions that it is today, or the last time you read it, do you have a projected cost or what it would cost the county yet?
You can't have a projected cost because there's no way of knowing what somebody's going to talk about in a negotiation. That's assuming motivations of certain actors that I don't think we have a way of making that determination. There's a lot of variables at play in any dialogue about those matters. So there's really no way to ascribe a true cost to it, but it would considerably change how we currently budget and how we and do human relations, employee relations at the state and local level.
But we just have to keep our eyes on that one for sure.
So no speculation on how it would affect Mecklenburg County?
There really isn't. It really depends on a series of choices by a lot of people that we don't necessarily have control over what they're going to do or not do. So there's really, the only thing I could definitively say is we would absolutely need employment legal counsel in that area. That's for sure.
Okay. That's all you got?
Yes, sir.
Okay. Well, Mr. Brinkley got a whole page written down over here, so you can go now.
I got it so scribbled, I ain't sure I could read it. Well, just on Kyle Crump, I had the privilege of serving with him on the planning commission for 14 years, and he was the chairman all 14 years. And I had to give it to Mr. Crump. He always come prepared. He had done his homework, and he was quite an asset to that planning commission. Mr. Bug, he's a good guy. He don't live 3 or 4 miles through the woods there. The trailer park, growing up, anytime it was a big party or a lot of loud music, you didn't have to wonder where it was. It was over. You just said it was over at Bugs. That's where it was. Our emergency service, what VCU got up here today and said about the trauma center and all. The rescue squads throughout the county, the fire department, the sheriff department. It's hard for me to believe that any county in the state of Virginia's got anything better than what we got going on here today. It's really good. A little follow-up a little bit on Dennis. I kind of agree with a lot what Dennis said there. And, we're talking about this legislation that's being kind of pushed down on us down here from Richmond. You mentioned, Alex, a few things there that maybe we could have a little say-so or something on it. And I think when legislation is over, we can make a list of those things and we revisit them to see where we want to go instead of just kind of putting them on the back burner, and do that. Also, Mr. Gravitt and myself have gotten a few complaints over at Mooresville where they got a few dumpsters and the trash is going across the yard and stuff and complaining. I was just wondering if we put in a convenience center at Bluestone Middle School, wouldn't they be going there too?
So Bluestone Middle School, I would anticipate during the next fiscal year, so sometime later in this year, that we would be up for bid. And then Generally, if things are favorable, we've been experiencing a year-long time frame, but unfortunately, on most of our projects, they have not seemed to be favorable. So they've taken, yeah. But it was no dumpsters would get pulled until the facility was operational. So I would imagine you're looking at this point a year and a half.
Well, my thought is, you know, when it is done, the convenience centers, it's not going to be one any closer than either Bluestone or Cal Road, Penn Road. I would say today, just move them and take them over there, because I mean, you just take the trash over there. We'll have all them dumpsters over there. I would just say move them, because it's, you know, I wouldn't want all that trash going across my.
And we do have, so Bluestone is currently serving as a dumpster site. You know, we left several dumpsters there, and we have moved other dumpsters there as other landowners have told us to remove them. And part of that is the theory that you get people accustomed to where they're ultimately going to be going to bring their trash. So if it's the desire to move them now, then we can certainly do that and just expedite the process.
Being in my district, that's my desire today, to go on and move them.
Consider it done. Yes, it'll be done tomorrow.
I think you waved the wall.
Yeah. Hold on a minute. Let me look around here. I think that's it. I want give Mr. Hargrove the floor.
Thank you. Go ahead. I do thank the Sheriff Department for inviting us to your banquet. It is amazing how much you guys have done and is continuously are doing. And I also, Mr. Wilson, congratulations for your new position on agriculture.
Thank you.
I heard Mr. Jim said congratulations. He ain't said nothing but assistant chair. Yeah.
Well, he's the one that's got to do all the work.
I get the crumbs.
And I'm also proud. I'm just ecstatic. I just can't wait for the safety building to get moving, and I'm just that much excited when I walked up on the grounds today and saw our new EMS truck, and it was amazing. And I thank Mr. Justin, if you don't mind, to give Mr. Brinkley his first ride landing.
I hope it's volunteer.
And I'm hoping that we can do something about this drug. Was it kratom?
Yeah.
I hope we can do something about that. And not only that, the trauma center. I mean, it's amazing. I mean, all good stuff. And Ms. Brinkley, if you don't think you're going to make it to heaven, we'll give you a ride in a helicopter. Make sure you get close.
Just give me that.
He said if he gets that high, he can come back.
That's good. That's awesome. Thank you.
All right, thank you, Andy. You know, everybody said everything that needed to be said. To be honest with you, I completely agree with all the good things going on in the county. I would like to bring up one thing. You know, there are a lot of people on social media that don't realize how many good things we got going on in this county. And it gets distorted, and I wish it wouldn't, but it does anyway. And I don't know how we can counteract that. I don't know if we need a higher level promotion, sales pitch for all the good things that are going on in Mecklenburg County, but it's something you can think about. But I mean, some of the negative comments that come out are just absolutely ridiculous and don't pertain to this county. They just simply do not know how good we got it in Mecklenburg County. So I did want to mention that. I don't know, Alex, if you got any magic wand to wave across social media on how we need to promote Mecklenburg County even more than we already do. You can be thinking about it. Every county employee can be thinking about that. But I know y'all see it too. You see it on social media, and it's absolutely ridiculous, some of the things that people say about the county. But there are a lot of good things too. But anyway, it's when you're standing behind that keyboard and nobody can see you, I guess you get to be a tough guy. So, warriors. Yeah.
Probably a lot of that won't never change regardless of what you put out there.
Yeah,
sadly.
You're right. But I did want to mention it. I do want to mention, too, that the Loggers Association is having a fundraiser at Arrowhead Gun Club. It's a skeet shoot. And I want to bring up what they did last year. I think it's about 5 or 6 loggers in Mecklenburg County that participate in that. And it's regional. It's a lot of them that come in there. They were in that one day last year, they raised $130,000 and gave it to the Children's Miracle Network. That event is going to happen on March 20th here in just a few weeks. So that's just outstanding that they step up to the plate and give that kind of money to a charity. I mean, somebody was donating some pretty big dollars to raise $130,000 in an afternoon shooting skeet.
Absolutely.
That's pretty strong. So I did want to mention that. Other than that, I don't have anything else. I think we look forward to going ahead with the budget. I'm sure Alex has got it in good shape. And
There's still some variables that need to be worked on. So
they always are. So anyway, I don't have anything else, so I guess we'll stand adjourned.